Hi, I'm Dr. Arechiga, and today I'm going to give you an introduction to the Community Resiliency Model. This model was primarily developed by Elaine Miller-Karras, and it's a model that I've found particularly useful in a number of settings. So I'm a clinical psychologist, and I'm also a preventive care specialist. And I'm a member of Loma International Behavioral Health Trauma Team. And this is a model that we use and teach individuals around the world. In addition, I use it clinically. So I have a small little private practice where I use it to help students from around the university work on test-taking skills and test-taking anxiety. So I found this to be a really useful model, and I'm excited to be able to share it with you today. So when we talk about resiliency and resiliency-informed care, we know that individuals can become more attuned and able to use the community resiliency model skills for self-care. And we know that as individuals use these skills, they not only improve their own ability to manage stress, but they can help others around them with these skills as well. So I like to use the example of flying and the safety announcements that they give. So when the oxygen mask comes down from the ceiling, what are you supposed to do? The idea is you put it around your own face first. And why is that? The reason is because the better that you're able to keep safe, then you can help those around you as well. And I like this. And it really relates to the community resiliency model skills as well. So the more that you use these skills for yourself, for your own self-care, your own self-regulation, the better you are at handling those things around you, the better you are able to serve your community. Now, these interventions are easy to learn. So they're a set of 6 skills that are taught to members of a community, taught to students, individuals, that can help bring our mind and body back into balance. We don't talk about the past. Even if reading and writing are difficult, that's not a problem with this model. We found in our international work that it's useful for the young and the old, individuals with a lot of education and those with none. We've honestly presented this model around the world in many different countries and found it to be very effective. In addition, there's a really useful app that I always recommend, and it's called iChill. CHILL, and you can download that for the iPhone or Android, and it's really useful. And I'm going to come back to that app towards the end of the presentation. So, what do we mean by resilience? To quote the founder of the model, Elaine Miller-Karras, she says, "Resiliency is an individual's and community's ability to identify and use individual and collective strength in living fully in the present moment, and to thrive while managing the activities of daily living." So simply put, resiliency is a person's ability to use skills throughout the day to manage all the challenges that they encounter. And right now, with all the challenges we have going on, not only locally, but internationally, I think that these set of skills will be very helpful for you. So as Elaine developed this model, she really based it on the elegant design, the laws of nature, the autonomic nervous system, and neuroscience, and the latest studies on trauma and stress and how the brain operates under those conditions. So, why a biological model like CRM? Simply put, because stress is a biological process. So for both children, adults, all of us, traumatic and stressful experiences can affect the body, mind, and spirit. And these experiences can produce a biological process of dysregulation that is self-perpetuating even in the absence of ongoing external stressors or threats. And although insight about these life experiences can be helpful, it may not, and for many does not, bring the nervous system back into balance. Meaning can be placed upon the experience that can include shame and self-blame and be harmful to the human spirit. In CRM, we say that the primary focus is biology and not mental weakness. In my own profession of clinical psychology, often we get stuck on the psychopathology. But the nice thing is when we work with CRM, we really just primarily focus with the biology, and specifically the biology of the stress response. So when we talk about stress, and at the other end of the continuum, trauma, we talk about the autonomic nervous system. And there are two branches to the autonomic nervous system. One branch, the sympathetic, revs us up for fight or flight. The other side is the parasympathetic, and that slows us down and brings us back into regulation. Now, the sympathetic, when it revs us up for the fight or flight response, things like our respiration rate, our heart rate, our pupils dilate, our blood pressure increases, and we release stress hormones. In addition, things like digestion come to a stop. In fact, if you're a person who doesn't like public speaking, and when you get up front, you notice that your mouth gets a bit dry, it's because salivation is the very first step of digestion. And so it starts to slow down as our sympathetic nervous system increases. Now, once the threat is passed, the body wants to regulate, right? It wants to come back to homeostasis. And it does that by using the parasympathetic response. So the parasympathetic nervous system slows the body down. It's the opposite of the sympathetic. So it slows the respiration rate down, slows the heart rate down, and the sweating and the stress hormones. And then it starts up the digestion process. Now, when we talk about the brain and the nervous system, there's functionally three separate areas that we talk about. The survival brain is what comes up into the brain, out of the spinal column, into the base of the brain. And the survival brain and those functions are really important for our unconscious processes, things like digestion and reproduction, circulation and breathing, those functions that keep us alive. Now, the mid part of the brain is what we call the limbic system, and that's really the emotional center of the brain. The limbic system assesses risk and involved in the expression and mediation of emotions and feelings. And then we talk about the outside of the brain. So the outside of the brain is the cortex. And the cortex is really where our ability to think and engage in rational thought takes place. The challenge is what happens when we have too much activation of the sympathetic response. So I like to use an example from Daniel Siegel. He's a psychiatrist at UCLA, and he writes extensively on the stress response. And I love his example. So imagine that these are the two hemispheres of the brain. Coming out of the spinal column into the base of the brain, you have your survival functions. If you fold your thumb over the mid part of your brain, that's the limbic system. Fold your fingers over, that's the outside bumpy part of the brain, that's the cortex, the thinking part of the brain. Now, what happens when we have increasing activation of the sympathetic nervous system? The limbic system starts to hijack the cortex. And when we get enough activation, the cortex starts to change in its functioning, especially the prefrontal cortex, which is the executor of the mind. And with enough activation, that cortex changes, and then our ability to engage in rational thought, our ability to remember things and to learn and to attend to things all start to decrease. In fact, if you've ever been studying with another student and you notice that they're a little bit anxious, you might also notice that they're having a little bit of difficulty remembering some of the stuff that they've just learned. So CRM and the techniques that are part of the model are all designed to help us know when our sympathetic nervous system is starting to activate, and then to use a series of techniques to bring that activation down so that we can get the most out of our cortex. I mentioned the limbic system being the seat of emotions. Within the limbic system, there are two structures, one in each hemisphere. They're roughly the shape of an almond, and they're called the amygdala. And our amygdala are vital in threat assessment. So they're constantly appraising the environment for threat, both external and internal. And what they do is they help create positively and negatively charged memories from the information that they receive. Now, there are structures connected to that called the hippocampus that are vital in memory formation. And right now, neuroscience is informing us that traumatic memories get stuck, as it were, in the amygdala and don't get processed appropriately in the hippocampus. Now, when we talk about trauma, it's important to distinguish between two kinds of memory. The first is explicit memory. And explicit memory is a process of conscious learning and storing of information like facts and events. So as you're studying for an exam, you're engaging your explicit memory. Now this develops around the age of 18 to 24 months old. Before that, our brain isn't quite developed enough to form explicit memories. But associated with that memory is a timeline where it occurs in our life. Now that's different from implicit memory. Implicit memories can be triggered out of the blue, and they don't have a sense of self and time, and they can actually develop before birth. And these include body memories and sensations associated with traumatic memories. And so when people talk about having a flashback, indeed, it's implicit memories and these traumatic memories that get triggered. In fact, neuroscientists say that when somebody who has PTSD, for example, is triggered, their whole body remembers what happened physically. Indeed, it's not just like a black and white two-dimensional image of a memory. It's really what some individuals call a memory capsule. So it's everything that goes along with that experience, the pain, the numbness, the trembling, the nausea, the shame, the anger, everything that goes with that memory gets brought up when it's triggered. The good news is that adversity is not destiny. So just because we experience something stressful, just because we experience something that might be traumatic or even life-threatening, does not mean that we're going to develop challenges later on. In fact, research informs us that only about 20% of individuals who experience a life-threatening trauma develop PTSD. And there's been a number of studies that have started to look at things that can protect us from developing conditions like PTSD. There was a fascinating study done by Dr. Christina Bethel out of Johns Hopkins University. And she investigated the associations between adverse childhood events and factors that affect children's development and lifelong health. And adverse childhood events are things that are traumatic in the developmental period from the age of 0 to 18. These could be an incarcerated parent, abuse, neglect, things such as that. And we know that the more ACEs you have, the more adverse childhood experiences that you went through in development, the more detrimental that can be to your physical health. But in this study, Dr. Bethel defined resilience simply as staying calm and in control when faced with a challenge. And what she found is that for children ages 6 to 17, staying calm and in control when faced with a challenge ameliorated the negative impact of adverse childhood experiences. There were higher rates of school engagement among children with adverse childhood experiences who demonstrated resilience. And so for us, this is important. Simply learning a set of techniques we can use to stay calm in the midst of a stressful experience can be very beneficial when it comes to the long-range impact of those things that we've experienced. Now, what do we mean by stress? Stress is really the body's reaction to a threat, and it's about perception. So, for instance, I would never like to get pushed out of an airplane with a parachute on my back. But there are people that really enjoy that, right? So for skydivers, that's a really wonderful experience. For me, that would be a highly stressful, maybe even a traumatic experience. So part of it is about perception. But there are things that many of us face that most of us would agree are pretty stressful. For graduate students, for doctoral students working in their education, all of these tests that you have to take are very stressful, especially when they represent a milestone that we have to pass in order to take the next step in our education. So, the autonomic nervous system is really what responds to stress, whether that is an external thing, whether that's thoughts, whether that is stress that comes from internal sensations. It's really the survival brain that is driving that reaction. Now, there are many different reactions to stress. And it can affect us in our thinking, right? We might become a little bit more paranoid. We might have nightmares. We might experience forgetfulness. or our thoughts might just be a little distorted. Physically, we can experience an increase in physical pain. We might notice a rapid heart rate. We might notice muscle tension or sleep problems, or even stomach upset. Emotionally, we can experience fear. We might experience anxiety or avoidance, or even shame or guilt. It can affect us relationally, right? It might cause us to isolate more or become more angry at others. Behaviorally, it can lead to isolation, self-injury, even addictions or abusive behaviors. And then finally, spiritually, it can lead to a sense of hopelessness. For some, it might lead to a loss of belief or an increase of belief. So stress, and on the other end of the continuum, something more significant like trauma, can affect us in many different ways. Now, the good thing is that with that perspective of biology, we look at it different. We look at biology and not mental weakness. And we realize that all of us can experience stress. And so skills such as those taught by the community resiliency model can help all of us manage the daily stressors more effectively. And we know that these reactions really can't be talked away, but they can be sensed away. So we learn that the symptoms of stress, they're really about the biology and not pathology or mental weakness. All of us, regardless of our education, can become highly stressed. And right now, with all the events happening locally and around the world, in addition to the stressors of our education, it's a challenging time. And I really believe that these skills can help all of you more effectively deal with the current stressors that you're undergoing. Now, one of the concepts that comes up when we talk about stress, when we talk about trauma and resiliency, is that of post-traumatic growth. And post-traumatic growth has been studied for years, and there's a lot of research on it. But it's really the positive psychological and spiritual changes that can be experienced as a result of the struggle with highly challenging life situations. So, what are some of the ways that you or those you work with have experienced post-traumatic growth? Individuals might talk about increased resilience, a sense of internal strength, maybe a gratitude for life, increased hope, an appreciation for loved ones, or a greater sense of forgiveness. It might help us to increase our faith, give us clearer priorities, and deepen our compassion for others around us. And so, as we think about the difficult times that we're facing, keep an eye out for those little positive nuggets, those things that are occurring that are bright spots. You know, right now, all of us are learning to communicate in different ways. Some of us are teaching classes online like we haven't done before. Some of us are communicating with others online instead of face-to-face. So these are things that might improve and change interactions over time. So one of the concepts that's core to the community resiliency model is the resilient zone. And other theorists have talked about this as the window of tolerance. But the resilient zone is where we function the best in body, mind, and spirit. So it's an abstract representation of the functioning of our autonomic nervous system. When we're balanced, when we're in our resilient zone, our cortex is fully engaged. Our ability to think and remember and to process information is fully intact. And when you're in your resilient zone, you can still experience stressors. You can still get upset at things and maybe even be upset or angry. But what we aren't is washed away by those emotions. We're able to regulate. So our cortex stays engaged rather than getting bumped out where we struggle more significantly. Now the challenge is what happens when we get triggered by something, when we're presented by a stressor that causes our nervous system to do this. The skills of the community resiliency model are designed specifically to help us realize when this is happening and give us a set of tools to help relax that. I like to tell people these skills are a nervous system hack. I'm going to teach you a way to pay attention to the activation of the autonomic nervous system through a process called interoception and tracking, and then to use a set of skills to calm that process down, to activate the parasympathetic response so that we can get that cortex activating in the way that it should. As I said, stress is a biological process, and even a little bit of stress can cause a person to become anxious or afraid. Some individuals get stuck in that high zone, some in the low. Some can go back and forth between the high and the low. And when that happens, it's difficult for us to concentrate. It's difficult for us to learn and to remember what we're studying. Now, some of us have a very shallow resilient zone, like I mentioned. Some have a deeper one. And it's my belief that the more that we practice the skills of CRM, the deeper that resilient zone can be. The more we can handle stresses around us more effectively. And that's one of the biggest goals of this model, is that we can handle the stresses of daily life in a much more effective way so that we can be more effective students and partners and community members. Okay, now it's time to get into the skills of the community resiliency model. There are 6 of them, and I'm going to spend most of the time on the foundational 3 skills. The very first skill is called tracking, or reading the nervous system. And tracking is based on interoception. And interoception is our body's awareness and our mind's awareness of internal body states through sensations. So for instance, how do you know you need to use the restroom? Well, there's internal sensations that clue you into that. How do you know it's time to sleep? Once again, there's internal sensations that let us know that. How do you know it's time to eat? Once again, it's interoception that informs us, okay, this is what needs to happen. So tracking is based on that. And it's a wonderful skill and the most foundational of all of the techniques in this model. And tracking really helps us stabilize the nervous system. So as we explore the sensations connected to well-being, it's really helpful in making us feel better, body, mind, and spirit. And tracking, as I said, is foundational. It's used with every other technique. So tracking is what lets us know we're starting to get too much activation in the sympathetic nervous system. Tracking is what lets us know when we use any of the other skills that they've been effective. So I usually tell most of the people I worked with that tracking really is the foundational technique, and it's one of my favorite in the model. As we learn to track, we can more effectively learn to read the nervous system so that we can tell the difference between sensations of distress and those sensations of well-being, which is vital when we work with this technique. You learn to be able to read the nervous system, and then what you realize is you have a choice of what you pay attention to on the inside. We can choose to focus on the sensations of distress, or we can choose to shift and focus on the sensations of well-being. Now, how do we track? So I've included a number of examples of sensation words because tracking is one of the trickiest skills of the model, I would say. In fact, when I first learned the model, I wasn't very good at tracking. But as I've used the model, as I've taught this model to hundreds of patients, hundreds upon hundreds of people around the world, I've learned to use these skills for myself more and more effectively, and my ability to track has deepened. So this is not an exhaustive list, but what I would encourage you to do is kind of use it as some examples so that when you start tracking and tuning in, you can start to be more aware of the different changes that are taking place, whether it's muscle vibration, pain, temperature, heart rate, or breathing. These are all examples. Now, when we talk about the sensations that we pay attention to when we track, there's 3 different kinds of sensations that we talk about. There's those that are associated with stress. So we think of the shallow breath, the rapid heart rate, the tense muscles, the pain or the coldness or chill. When we talk about resiliency, we notice a deeper breath. We notice a slower heart rate, relaxed muscles, a sense of being more grounded or calm. And then when we shift between sensations of distress and those of wellness, we might notice these additional sensations that we call release sensations. They might be a shaking or trembling, maybe even a little burping as that GI system comes back online, yawning, or even tears. And when that occurs, when we're training somebody in the model, we just bring somebody attention to that and normalize those sensations. As I've trained individuals, I've had people talk about release sensations down their arms that they describe as more tingly sensations, but pleasant. So, skill number 1, tracking. How do we track? Tracking is turning into the nervous system and the body's responses. Are those sensations that you're noticing pleasant, neutral, or unpleasant? Bring your attention to your heart rate, your breathing rate, muscle tension or relaxation. And ask yourself, what do you notice happening on the inside? When we teach somebody to track, we observe their responses. And we ask them what they notice about their posture, muscle tension or relaxation, their breathing. We might even notice changes in skin tone. And we will ask, what are you noticing? What are you aware of on the inside? Do you feel sleepy, clear and focused, sad or happy? Now, like I said, tracking is so foundational because it's used with every other technique, and it's the technique that tells us we need to use some of the other techniques in the model. And it'll make more sense when I teach you the next 2 techniques. The next skill is resourcing. And a resource is something individual to you from your life that brings you great happiness and joy. It can be a person, place, or thing. It can be a favorite memory from childhood, a favorite place that you've been, on vacation or that you like to go, such as the beach. It can be internal, such as a sense of humor that has gotten you through difficult times. It can even be imagined, and we use this often with children or those with more impoverished backgrounds, something like a superhero or a character from a book, something that they can identify with. But a resource is individual to you. And it can be a person, place, activity, faith. It can be a strength, but it's something that brings great meaning to you. And I like to tell people that I train, it puts a smile on your face. So when you talk about your resource, you often get a nice, strong smile on your face. Resourcing builds a sense of internal strength and resiliency and reinforces a sense of one's own abilities and capabilities. The pleasant and neutral sensations connected to your resource can bring a direct experience of well-being and help stabilize the nervous system. It triggers that parasympathetic response and helps bring that cortex back into balance. Now, once you identify a good resource, we go through a process called resource intensification. So we typically ask 3 or 4 additional questions about the resource to expand the sensations connected to it. For instance, let's say your resource was the beach. You loved going to the beach. Then if I was working with you, I would ask you what you saw on your favorite beach. Is it the sky? Do you notice the ocean? Do you notice the beach and the sand or the people playing? What do you hear? Do you hear birds? Do you hear the pounding of the surf? Do you hear children playing and laughing around you? What do you smell? Do you smell clean air, fresh air? Do you smell the brine of the ocean? Maybe the smell of sunscreen, lotion? And what do you sense, maybe on your skin? Can you sense the warmth of the sand beneath your feet? Or the warmth of the sun on your face? As you use more and more of your senses to deepen and expand upon that resource, that helps engage the parasympathetic response even more, and it becomes even more effective as a way to bring our nervous system into balance. Now, resources can have many natures. And so it's important to recognize that while there's an aspect that might be wonderful, there might be another aspect that's a little difficult. Often when I talk with students, they'll mention their parents and how their parents have been so supportive and wonderful to them over the years. But then their face will shift and it'll drop and they'll recognize that, ooh, they haven't talked to their parents about how much they're struggling in school. So if it's a little bit difficult to find the positive aspects, then it might be useful to shift to a resource that's a little bit more simple, less complex, and one that can hold those positive aspects a little bit more strongly. So now this is where you get to practice. So write down 3 resources. And then as you look at those resources, circle the one that puts that smile the quickest on your face, the one that has the most pleasant, positive meanings for yourself. And then write down 3 or more details about that resource. Intensify it. And remember to use as many senses as possible. You know, what do you see in your mind's eye? What do you hear? What do you smell? And what do you sense on your skin? And then as you read the resource and the details, track and notice the sensations that start arising on the inside. And especially focus on the pleasant or neutral sensations that you're aware of. And that's how we use a resource. So the idea is, as we're going throughout our day, we're just tracking. And we notice a sensation that we would identify as unpleasant, and we pause and we take a moment and we bring up that resource. And as we bring up that resource and all those sensations associated with it, then be aware of the shifts that start to take place on the inside and really notice that. And that's how we use a resource. So we start with tracking, then we use the resource when we need to, and we track, and that tells us whether or not it's been effective and whether or not we need to spend a little bit more time with that resource or if we can go on about our day. Now the next skill is grounding. So tracking, resourcing, and grounding form the foundational 3 of the community resiliency model. And if I only have time to teach somebody a few of the skills, these are the 3 that I start with. So grounding is taught in many different approaches right now. It's really popular. And grounding is done in different ways. You can ground in many different ways, in fact. Grounding is really the act of using our body in conjunction with the physical environment to help focus our thoughts to the present moment. So the more activated we are, the more we start to get bumped out of our resilient zone, the more that our mind starts to race and we start to think about all the negative things that could happen. We start to ruminate on the past. We start to focus on all the negative sensations that start to arise. And grounding is a nice way that we can bring calm to the nervous system. Now, a little bit of caution, and there's a reason that we teach resourcing before grounding, because some individuals, depending on their life history, might find the act of grounding a little activating. So it is important to start with tracking, which is the foundational technique, and then develop a nice resource before going on to grounding. Now, like I said, there's many different ways to ground, and I find it to be very effective at managing the nervous system. And for students, I would say students, when they're taking tests, they often tell me that simple little grounding techniques are often very effective throughout a testing process. So if it's okay with you, I'm going to lead you through a little grounding script. And this is just one of the ways that I teach grounding. So go ahead and get nice and comfortable in your chair or your sofa or wherever you're sitting. And as you sit there, you can keep your eyes open or your eyes closed. Often I close mine during a grounding process. So as you're sitting there, just bring your awareness to the top of your head and let that awareness drift down to your shoulders, your upper back, and just notice the way that the back of the chair supports you from behind. And then let that awareness drift down to your mid-back, on down to your low back or your upper thighs as you sit on that cushion. And then let that awareness drift down to your thighs, your calves, and finally your feet as they rest upon the floor. And then take a moment and gently scan your body and pay attention to those areas that are more neutral or more pleasant in sensation. And once you've identified at least one place in the body that's more neutral or more pleasant, take a nice deep healing breath in through the nose and out through the mouth. And then bring your awareness fully back to the present. And then track and tune in and ask yourself what you're noticing, what you're aware of on the inside. That might be in your core. It might be muscle tension somewhere else in the body. And just be aware of that for a moment. And then if you were able to identify a place in the body that was more pleasant or neutral, I would invite you to shift your awareness to that place. So that might be your feet or your thighs. And if let's say it's your feet, I would invite you to bring your awareness down to your feet, and if it helps to wiggle your toes, go for it. And just once again track and notice what happens on the inside as you're fully focused on that area. And that's something that you can do throughout the day. Whenever you're tracking and you notice your nervous system getting activated, you can pause, take a moment, and ground. And grounding takes time to get really comfortable with, but the more that you ground, the more efficiently you can do it, the more that you can do it in quick little moments, even in the middle of a busy testing session, the middle of a busy, chaotic workplace. So I would encourage you to really practice grounding because I found it to be very effective. Now there's a few more skills really quickly I'll mention. One of those are Help Now. And the Help Now strategies, when you go to the app, are a list of 10 that are not exclusive, but they're quick little techniques that can be used when you're bumped out of that resilient zone, when there's a lot of stress and you might find it difficult to focus on a resource. So the first one is just take a nice drink of water or juice. And so I would encourage you to give that a try. You know, as you drink that water, just pay attention to the cool, soothing nature as it goes down your throat and nourishes the body. One of the Help Now strategies that I've helped develop with some of the students is something that I like to call temperature, texture, touch. So you place your hands on the desk in front of you or something beside you, and you notice the temperature first. So a little warm. Then you notice the texture, relatively smooth with a little bit of grit. And then touch, like, is it hard, soft? And then as you do that, you take that nice deep healing breath in through the nose, out through the mouth, and just really notice being grounded. And that's a nice quick little technique you can use to just take some of the energy out of that nervous system so you can refocus on the exam, or you can ground yourself real quickly before you do something. For instance, sometimes when I do public speaking, I'll just lean my hand on the lectern and nobody will notice what I'm doing unless I've trained them, and then they might pick it up. But I'll just notice the temperature, the texture, the touch, and just ground myself real quickly. So the Help Now strategies are very nice. And then another technique that I'll point out that is in the app is Shift and Stay. So Shift and Stay really talks about learning to shift from those sensations of distress and discomfort to those that are more soothing. You can shift back to a resource and spend some time with a resource until you really are able to sense that that nervous system is regulated and you're back in your resilient zone. You can shift to a grounding sensation, or just internally, as you're grounding, you can shift to those sensations that are more pleasant or neutral. For some individuals, they even notice that certain gestures are soothing. So for instance, I know some people that like to play with their wedding ring a little bit, and that's a soothing gesture. Or individuals that like to just rub their thighs just kind of lightly, and that helps the nervous system reset. And that's just yet one more technique that you can use and incorporate in managing the stresses of daily life. People often ask me for suggestions when it comes to these skills. And initially, what I would say is, what are you already doing to widen your own resilient zone? You know, taking time to out in nature, taking time focusing on things that are uplifting around you in life. I think it's vital that every day, especially during these really stressful times, we take time specifically to focus on those things that deepen our resilient zone. And then if you found any of the CRM skills helpful, download the app. Download the iChill app. It's free, which is wonderful. And I've given this app out to hundreds upon hundreds of people around the world. It's really wonderful. And if you have your app and you hit the button that says Skills and you turn the sound on your phone and the volume up, when you hit the different skills, you're going to listen to Elaine, the founder of the model. And so one of those things you can do to start practicing the techniques right away is listen to Elaine lead you through grounding. Unless you've been trained in grounding before, I think it's helpful to hear somebody guide you through that. And so I would recommend that when you wake up in the morning, take a moment and listen to Elaine guide you through that grounding. And then at the end of the day, when you're getting ready for bed, when you're relaxing, take a moment to ground. And over time, those skills will strengthen, and then you won't need the app. But initially, it's really helpful. It's also helpful if things are so stressful that you can't remember the technique, you can't remember the specifics. Go back to the app and listen to Elaine train you in that specific technique. Very effective. And then track. I can't say it enough. Tracking is the most important foundational skill, and it gets better with time as we tune into the sensations of the nervous system. So when I was first trained in the model, I wasn't that good at tracking. And now, after working with this model, using it for myself, helping train other people with the model, I'm much better at tracking these little sensations internally. And then it's possible that new beliefs, feelings, or meanings may come up as you use a skill. Pay attention to sensations that are pleasant or neutral when this happens. And then finally, remember, the more you practice these skills, the more powerful they become, and the more resilient you will become. As I'm ending, I'd just like to point out Elaine's book, Building Resilience to Trauma. If you found this model helpful, it's a nice resource to go back to. And then here's a little bit more information about the Trauma Resource Institute, which is the nonprofit organization that Elaine set up to help expand this model and to bring it to the world. Thank you very much. I wish you the best.